today we are conducting NULS workshop at Care Banjara Hospitals in association with the SEMI board. The main intention of conducting this program is to enhance the skills of emergency doctors. This program helps them in many conditions, especially when they are in dilemma of diagnosis, dilemma in management of cases, in dilemma in disposition of cases. So in the same program, we are going to teach about basics of ultrasound, right from the selection of the probes, then how to get acquaintance with the knobology. Then we are going to teach about how to do chest ultrasonography, then abdomen, then cardiac, then how to detect the DVTs, then pulmonary thromboembolism, then protocols like RUSH protocol. So these are the things we are teaching in this NULS workshop. I hope this workshop helps all emergency fraternity to deal the case in a better way in all the ways, like diagnosis, then clinical management, then proper disposition of the case and patient. So this is how this program is going to help the emergency fraternity.
I'm really happy with the response from the delegates, from the candidates for this. So with this course, I'm sure that the care for patients presenting to the emergency department across all the hospitals will definitely increase as well as improve based on the skills which will be carried forward by the recipients of this course after the workshops once they have completed.
I've seen a huge crowd assembling here, trying to enhance their skills in the ultrasound life support, and looking forward for such workshops in the future. It was a nice effort by Care Banjara management. Ultrasound has become a stethoscope for the emergency physicians. This helps in diagnosing the uncertainties, providing clinical precision, and delaying the decision delays.
National Ultrasound Life Support Workshop. It basically trains the residents, the budding emergency physicians, to learn about ultrasound. Why is ultrasound so important is it's a basics test, which helps us diagnose multiple conditions being just on the bedside, and it's not very time consuming and it's cost effective as well.
As you all know, when a patient comes into the emergency department, it's important to have the right doctor at the right place for the right treatment, so that you are ensuring that the morbidity and the mortality is reduced.
The ultrasound has become an essential tool for emergency physicians. It's not just limited to the radiologists anymore. So recognizing the importance of this tool, Dr. Kiran has composed a well-drafted workshop for the ultrasound for all the emergency physicians and residents across Hyderabad.
ultrasound, so I'm practicing since last 8 years, and the best thing I learned as a skill is ultrasound, because in emergency care, every time there will be a patient coming to the emergency department, you want to diagnose the patient at the earliest.
The workshop has been really well since morning, and all the sessions were very educative, very informative, and it is of utmost help. Some of the protocols that we usually follow also are being taught, and the workshop are all hands-on, and it's very useful, and it's still going on, and it's very helpful for us.
It's not about just learning, it is also practicing hands-on. So by practicing hands-on with ultrasound, with the help of ultrasound, we are going to treat a lot of patients, and their outcome also. So definitely these kind of programs should be conducted even more, and in future also we are expecting even more.
Ultrasound is really an emerging tool in emergency medicine, and it helps in diagnosing the patient in within 10 minutes or 15 minutes. We can diagnose a patient in emergency situations in the department. So I'm very happy to see a lot of students coming here and learning this tool.
I thank Care Hospital Management, including Mr. Biju Nair, who is our Zonal HCO, then Medical Superintendent Dr. Rajesh sir and other supporting staff, so to conduct this program in an effective way. I also thank SEMI National Board and SEMI Telangana Board for giving me this opportunity to conduct this program at Care Hospitals, Banjara. I thank all the delegates and participants, then viewers and supporting team. I thank one and all again.